Welcome to the Stevenson University Library Nursing tutorial on evaluating and synthesizing information. Throughout your academic and professional career, you will need to combine or synthesize information from multiple resources. This tutorial will show you how to do that with the sources you've found. By the end of this tutorial, you'll be able to list the criteria for evaluating sources, understand the concepts of synthesizing and transferring information, and recognize when to stop searching for information and when to circle back for more. No matter whether your information is scholarly, clinical, or intended for patient education, you should evaluate it on the basis of 3 criteria before you use it: quality, timeliness, and relevance. Quality is one of the top criteria for information in healthcare. It's vital that the research we use to make decisions is accurate and reputable. One of the reasons we emphasize the use of peer-reviewed articles is that they've been thoroughly vetted by other experts in the field. Many journals have a peer review process, but they're not all exactly the same. Within a field, some are considered more prestigious than others. Using articles from well-known journals with a high impact factor is another way to ensure that the information is high quality. Quality articles should also include citations and a reference list, similar to your academic papers. Because of the continuously evolving nature of medical research and treatment practices, it is important to be aware of the timeliness of any information that you access. You should strive to use only the most recent and up-to-date information. The most current medical studies are generally less than 5 years old. Almost all databases allow you to limit your search results by publication date so that all of the results you find fit the required time period. You should also consider the relevance of any information to your needs or your patient's needs. Some questions to ask yourself are: how well does the information relate to your question? Who is the intended audience? Is the information at an appropriate level? You'll want to pay attention to the type of studies you're finding for your research. Some research topics or areas are better suited to either qualitative or quantitative research, and in some cases a combination of both is valuable in order to gain a holistic and comprehensive understanding of the topic. Remember, this information could greatly impact your patients' lives. You need to ensure that you are finding the most relevant and up-to-date information for them that you can. Synthesizing information involves taking information or ideas from different sources and combining them to form new conclusions about a particular topic. That might sound intimidating, but it's actually something you do all the time. Synthesizing just means that you take one thing you know and see how it relates to another thing you know. For example, you might take knowledge you learned in an introductory nursing class and apply it in a more advanced class on a similar topic. Or you apply concepts from class to your clinical and work experiences. When you do that, you're synthesizing information. Assignments in introductory classes don't usually require you to synthesize much information. If you're writing a paper on diabetes, there are lots of sources that discuss diabetes and only diabetes. However, upper-level assignments often require you to synthesize information because they're more complex. If you're writing a paper on the psychological benefits for adolescents who use insulin pumps compared to multiple daily injections, you may not be able to find multiple articles that discuss all of those concepts. Instead, you can look for articles that cover different parts of your topic and then synthesize them. Synthesizing sources doesn't mean summarizing each one in a separate paragraph in your paper. Instead, you'll want to pull important information from your sources and combine those points. As you do your research, you'll see similar ideas and themes emerge on your topic. This is an indicator that they are important and relevant to your topic, and you should be extracting these points. Once you've pulled out all of the important themes and ideas, you can start drawing connections between them to understand how they fit into a larger picture. An effective way to organize your thoughts and research is to create an outline or map for key points and understand how they interconnect. It's an important early step towards synthesizing your ideas in a logical order. Transferability, which is the ability to read research results and apply them to other situations, is an important skill to have in the nursing profession. A common use of transferability is when doctors or nurses read research studies and decide if the results apply to their patient treatments. For example, you don't want to utilize dosage procedures meant for adults on very young children. This is an example where the research on adults is not transferable to the care of children. However, if a study detailing drug interactions in adults demonstrates sample drug A and sample drug B should not be combined, you can most likely assume that those drugs also shouldn't be combined in children. This is an example where the research on adults could be transferred to the care of children. Transferability gives nurses the opportunity to make comparisons between different situations and decide what, if anything, can be applied to their needs. The important thing here is to really read through the research and make sure you understand the treatment methods. Don't make assumptions just because the topics sound similar. One very important detail to consider when looking at the transferability of information is the timeliness of the source material. Even if an article or research study matches to your current situation exactly, if it is out of date, you could be applying incorrect information. Finding articles and synthesizing the sources you've found is important, but it's not the only part of the research process. You probably don't have unlimited time to keep searching for sources, so you also need to know when to stop. If you're researching for a class assignment, your instructor may require a certain number of sources. Consider that a minimum, not a maximum. When to stop searching depends on the goal of your project. If your project is a simple report or discussion post, a few sources will probably be enough to support your writing. If your job is to find the most authoritative or leading information on a topic, you will probably need to look for more than a few articles. One way to tell how authoritative an article is to see how many times it's been cited. If many other researchers have cited it, that's a good indication that it's an authoritative source. If you're doing a comprehensive literature review, you'll do an exhaustive search for everything you can find on the topic. Often this means finding dozens of sources. There is no absolute way to know when you've exhausted the research on a topic, and more information gets published all the time, so you may need to revisit a topic in the future. Lastly, make sure you're aware of the types of sources that are required. For example, does your instructor require peer-reviewed articles only? Is it okay to use books and ebooks? What about websites or other online sources? Check the requirements carefully and determine if the sources you've gathered meet all the assigned criteria. Congratulations! You are prepared to evaluate and use information. Now that you're able to list the criteria for evaluating sources, understand the concepts of synthesizing and transferring information, and recognize when to stop searching for information and when to circle back for more. Thank you for watching. Contact the library if you'd like assistance. If you'd like to share feedback on this tutorial, you can do so at the link or QR code on your screen.